5 years. Oh, not too long ago, I've had a bone break, and I had to go to the emergency room for that, and I was in there, and they told me, you know, how you were going to pay for this, you know, after you're seen from the doctors, and I couldn't pay for it. They were asking for, like, I believe it was like $1,000 or something deposit, and then they can bill you the rest, but I told them just to bill me because it was kind of pricey. So sometimes you don't have that money on pocket, so they treat you a little differently when you do have health insurance.
She hurt herself at work a while ago, and there was nothing really we could do about it, so I had to take care of her. And then I got really sick, like really sick one day, and I couldn't go to the hospital because no health insurance, and we didn't have the money to pay for a hospital visit, so I had to be laid up in the house for about a week.
And suffer through, you know, no medication, no nothing. Yeah, so it's hard. It's hard when you don't have health insurance. You can't go to a doctor. You have to kind of like self-medicate, or you just have to suffer and go through the pains, you know,
wait
because
for it to pass.
But to pass, and hope that it does pass. And like, I'm diabetic, and if I didn't have friends or associates that pay for my insulin and stuff like that, I wouldn't have insulin. You know, and it's hard. And I even had, when I had one extra bottle, a friend of mine didn't have any, so I had to give her I gave her my bottle. Even though we're not supposed to share medication, but what are you supposed to do when you don't have health insurance?
You can't help it.
Everybody got to help everybody else.
It's a big problem with the younger generation, because a lot of kids don't have the job or don't have the, you know, income to pull in to have good health insurance.
No matter what profession you're in, right? If you get hurt and you're not able to work, and there's no unemployment, no disability, you know, where are you going to go from there? See, that's my situation. Where am I going to go from here? You know, now if I get up and I try to work a part-time job, that's all I can work with. I can't work anymore because I'm not able. Physically, I'm not able. So what I do, I try to find somewhere to get some health care. There's nowhere to get no health care because I don't have the money, you know, to pay for health care. So what do? Now that this new Obamacare thing is opening up, everybody's going to have exposure to some kind of health care.
Came out to find some resources, and ended up finding more than that.
We came out just to check it out, but ended up signing up to be a donor, and ended up signing up to get some medical insurance. So it worked out pretty well.
You need to come and find out about things in the community so that you can help someone else.
They had, you know, resources beyond my imagination. They had booths, vendors, things that helped me out personally and professionally, so it was great. I have high blood pressure and borderline diabetic, so they were able to give me some assistance there and help me out to where I could go and get other resources, other help.
I go to La Clínica de la Raza, and they only give me like discount, so I enroll in health plan. Some worry a little bit about if my insurance cover what the government said, and I'm very happy. Yes.
Well, I saw this event on the internet, and I wanted to come get the flu shot and see if I was eligible for health care coverage.
And were you eligible for it?
Yes, I was, so I'm very happy. It's been difficult because I got to try to find a clinic, and then they wanted all this information, so it's hard not having health care coverage or insurance. So at least now I won't be scared to get sick, you know, or scared to go to the doctor thinking I'm gonna have this huge bill. So I didn't know very much about the Affordable Care Act, so I'm happy that it went through. And you know, I'm single, I don't have any children. I was surprised I qualified for anything, so I'm happy. Yeah, so I'm gonna go home and tell my brother about it, you know, because he's my age too, you know, so he doesn't have health care.
I'm part of this bike collective called Bikes de Pueblo, supporting the local community and getting them on their pedals and healthy again. Ever since I was 18, I no longer had coverage with my parents, and since I cleaned myself as an independent as soon as I could, for tax reasons, for school, to make financial aid a lot easier, I haven't had health insurance. I go to a local community college, so I have access, or I have had access to a nurse during the semester. But due to the budget cuts in California, the services are far and in between the services that I actually need. So I've been going to kind of like local clinics, you know, pain sliding scale to see a doctor every once in a while.
It's really important for everybody to have health care. I mean, you can't just, if you see someone dying there, you're not, you know, not going to help them.
And then they're scared to go because they think they're going to get deported.
Yeah.
They're scared to go get help or go to the hospital because, you know, they think, well, if I go, they're going to deport me, so they won't go. And they're putting their life in danger.
A lot of people don't know about stuff like this, and they don't come out, you know.
Or they're scared to come out.
Or they're scared to come out. Everybody needs health. Everybody needs it.
We deserve it.